So, good morning, Dr. Art.
Morning. How is everybody?
Good.
Doing great.
How are you?
Doing?
Oh, I'm doing well. At least you asked me back, so I must not have messed up the last time.
No, we loved you.
I know we all love you.
Oh, good.
Your positive vibes. You're smart. But you're there. You're on the front line working with the people. You came up with some really unique ideas. We were talking about parking spaces today, actually. So,
it's a big deal. That is a very big deal for doctors, and we're giving it up.
But here's what happened. Our bariatric doctors said, give up your front door parking place so that you walk more and lose weight, right? So I go, so you mean as the president, I need to give up my parking place that I like? Just move it.
You know, back in the day, the closer parking spot was the high valued one. Well, if you want to be healthy, the high valued spaces might be the furthest ones now. It's a shift in mentality and shift in society. It's a great shift to make. And I'm used to parking that far away now. I kind of like it. It's that, it gives you time to think before you walk through the door too. So there's
Fresh
a lot of good things about it.
Yes, I love that. It's that morning air if I'm going to work, and if I drive to an office, if I do park far away, I love that fresh air in the morning. And like you said, my cobwebs kind of wipe away, and especially if it's a cool morning, I'm ready to go. So, so how are things at your office this week?
Well, we had a few setbacks as far as coronavirus. We had, I believe, 5 new patients tested positive. One of the problems is that you're hearing about the food processing plants having outbreaks. Well, we have a Smithfield Foods pork processing plant in our town. It's the big moneymaker for our town. It's one of our biggest industries. And I think they had one patient that tested positive a few weeks ago, and now we're seeing who they infected because I believe we had 9 people test positive at the plant this week. But the plant's doing everything they can to prevent it. It's just that's the natural spread of coronavirus. So luckily, the food supply is still safe. And, we're not hearing about them having to euthanize hogs or anything like that we process in our town. So the food supply is still safe as far as what's coming out of our factories. But, those patients, just as much as we are putting ourselves on the front lines, are putting themselves at risk just by going to work. And, when we open up and start bringing people back to work and things, these are the things we're going to see, and we're just going to have to deal with it. We're just seeing it earlier in the food supply because those people are still working.
So that's curious to me about, the people still going to work. Are there work policies put in place?
Oh, absolutely. I mean, these are things we need to get used to because as we open up again, we can't just open up back to normal because coronavirus is still going to be out there. We don't want everybody getting it all at once. So work policy, like we put our work policies in place right off the bat. We're all wearing masks all the time. We're wearing face shields now, full protective equipment when we're seeing patients outside of the office with fevers and chills. We're still locking down the office from people who are sick. So we've changed our processes, and we're going to have to do that for a while. So businesses that plan on opening as lockdowns get released, they're going to need to come up with their plan on how they're going to continue social distancing because that still has to continue because that's still what slows down the curve. And we're not just going to open up and let all our hard work go to waste by letting everybody get infected again. So the businesses have to come up with a plan. Movie theaters are going to have to space each other out I'm kind of vested in the movie theater situation because I was a background actor in Halloween Kills, and that comes out in October. And if they don't open the movie theaters up, I won't see myself on the big screen. So I got to see it on the big screen. So I want them to figure out their social distancing plan before October.
So I'm in the movie industry a little bit myself, and the red carpet scene is great. So let me know when your opening night is. I would love to come to opening night.
Well, I'm just a background actor, so I'm not going to go to opening night, but it opens October 16th if the world stays or the world gets a little bit back to normal.
Okay, I think we will. I think people just need to relax a little bit. Don't be so eager. Like you said, get those policies in place. Even if I had this talk with a woman who was really upset because they weren't letting her reopen her salon yet. And, but they were letting other businesses open, but not her salon. And I go, okay, whoa, stop right now. Write a policy and your standards of how you're going to reopen. Don't take no for an answer. You write the policies and standards. They might use it and adapt it for other salons, but you send it to the governor and you say, these are my policies and standards of how I'm going to reopen with COVID. You're not going to tell me I'm not. You tell me whether these are wrong. If you want to have a doctor look at them or a pandemic person look at them. But for each person that comes in, we're all going to wear masks. We're all going to wear gloves. When they leave, I'm going to wipe everything down and sanitize the area. Because salons can do this. Each chair in most salons are more than 10 feet apart because they don't want each other hearing each other. Mm-hmm. Trust me, your salon person is your therapist. They don't want the stories getting out. So it's easy to do. They just need to put their policy in place. What do you think?
Oh, good. Well, that's the next phase of all this is now that we've figured out that social distancing did work and slowed down the curve, and we want to keep the curve slowed, the next phase is to teach businesses and to have those policies into place. You don't need every business to come up with a plan, but your government needs to say, okay, this is what we expect from a salon. This is what we expect from a restaurant. This is what we expect. The salon, one thing you have to deal with is, what do you do with all that hair? That hair is contaminated hair with coronavirus, possibly. So you have to come up with a policy on what you're going to do with that hair.
Yeah, and the hair, we don't cover it up when we put the shields on. The shield only covers here. I have an issue with that because hair gets the viruses.
In Hong Kong, we have a salon chain called QB, and it's something I've never seen anywhere else in the world. Whatever hair falls off a customer is dusted off, swept to one side where there is a little port which is attached to a vacuum.
Oh, yeah.
And it just zips off, all the combs, all the cloth that they tie around you, around your neck. I've only seen the male things. I've not seen the female ones. And but that salon treats both men and women. This is what they do. So you have no hair sort of floating around on the floor. The guy who does it before he lets the next person in, he dusts down everything, sweeps it to that little port there on the floor, and the vacuum takes it off. And even they don't use water, so even on your hair, they just suck off the hair that is loose after they've cut it off with a vacuum thing.
One of the hairstylists I go to, he has one of those vacuums. He bought it from Amazon. It was only $60, and he puts it right next to where I get my haircut. He kicks it, and then the vacuum kicks right on, and the hair gets taken right up. And it's only $60. That's a very simple way of taking care of this.
Yeah, I mean, there's so many solutions, and people just need to think about forward. How do I protect not just my clients, but people? The other thing I said that's probably very important, especially today, is to collect all of their contact information, especially if they're not your regular client. Sure. And make sure you have a copy of their driver's license so that you can, if something is found to be contaminated, you can contact them. That to me is probably the most important.
Absolutely.
So in India, we are doing a practice where we are buying vegetables and fruits only with those vendors who are regular. We are not buying vegetables and fruits and maybe groceries who we have never saw that person earlier, basically, during this COVID, because you never know who is that guy, basically.
Yeah,
and secondly, whenever we are going to buy anything essential, maybe anywhere else, everyone is carrying their identity card, and with that identity card, they can track that person. In fact, they're writing down the numbers of the car or how you getting there and all those things. So we are trying to track each and every person, whoever is moving around, and that's the way forward. And also, when you talk about hairs, lot of people in India, they use hairs in their farming, basically. So because hairs has a lot of carbon, and it has some kind of things which is good for farming. So they put that hair.
Find one in seconds. Or don't go to Fiverr. Wait.
So they put it inside that.
I was trying to pull up a tracker, but it pulled up an advertisement.
I was thinking about your food factory, the
Smithfield
processing factory. I think they will have to upgrade to the kind of factories that you have in pharma industry with laminar airflow, positive air pressure, and that kind of thing, so that you don't have things getting into the food. Especially,
This place is very clean. They have all of that already. So this place has already been prepared that way. The last thing you need is one food poisoning to come out of your factory. We have had, this is a pork producing plant where there's trichinosis and all those. They have, since the 20 years I've been living here, they have not had one episode of that.
wow.
Yeah, Smithfield has been very, very strict. They did sell to the Chinese, own them now, because they sold, I think, back in 2015. But the reason why they bought them was because they were so strict and never had any diseases, because they lost all of their pig farms to viruses and diseases. And so the practices were of interest, right? But I am curious about if it does contaminate the meat, when we cook it, will it cook out?
Studies have shown yes. The virus doesn't survive heat. We already know that from the studies of sunlight, etc. And then especially if you do ingest it, you don't get coronavirus from your gut. So it's perfectly fine to eat food that has coronavirus on it. So I would recommend, if you don't know who the person is and they have coronavirus and you get the vegetables, you wash them off, of course. Wash your hands right afterward. But if you eat it, you're going to be perfectly safe. As long as you don't stick it up against your nose and go,
And I do that with my fruit, especially grapefruit. Oh my God, I love the smell of grapefruit and lemons. And I will smell them, but I'll stop.
It's not for
I will never
smoking.
smell another fruit again.
after you cut it open, the inside's probably fine. So
Okay, but I'm not going to do it now. There goes my fruit smelling days.
I think you have
I
stronger
was
stomach
breathing
acid that will kill any COVID.
yeah.
I used to think I was just breathing in the vitamin C from I love grapefruits and lemons. There's just something about that one. Or watermelon. Oh my gosh. When I smell a watermelon being cut open, I am just in heaven. But but these are good things to know. Knowledge is going to protect us, right? If we understand the nature of the beast, we can protect ourselves. And that's what this conversation is about, is how do we further protect ourselves, build our immunity, get lots of rest, exercise, get a lot of sunshine, cook your food well, cook it. But we should have always been doing that, right?
Mm-hmm.
I'm not eating sushi anymore for a long time because I want to wait this virus out. And I love sushi. I'm a big sushi fan, but
Same here.
I'm still going to eat it. My stomach will tell you, yeah.
Well, because your body can digest the COVID, you just can't smell it.
Yeah, and you're using chopsticks. You're not touching your chopsticks to your face or your nose. So chopsticks, boom, you're fine.
All right. So you just solved that problem for me. I just didn't think about that. That's right. Our stomachs can't get it. So there you go, folks. I mean, no, this is exciting news because, I've kind of been afraid of like some of the foods and things like that. So no, this is very exciting news. What else are in the horizon? I've noticed that North Carolina has gone up on the scale of, on the COVID rates. I noticed that they're breaking it down by zip code. Is there a reason for that?
Well, we know geography is a big deal. New York City versus San Diego versus here. We're lucky in my county. We still have a 0% death rate from coronavirus. Now we have 81 cases that have tested positive. We've had several hospitalizations, but because people spread out and we're protecting the most vulnerable and trying to keep them out of the office if they don't need to be, we have a 0% death rate in our county. Now, if you go to a county next door, you've got 2 or 3 who've died after 117 have been infected. It really depends on their comorbidities, their obesity, their other medical problems, the situation. Luckily, because of what we've done as a community and everybody taking care of each other, we haven't had it where people are dying because there's no ventilator, or people are dying because they were having a heart attack and there's no ICU bed for them. Those things have been protected against, but that's not out of the woods yet. So the distancing, yes, you want people to get back to their jobs and the economy to get back to normal. You want less domestic violence. You want people having less mental health problems and suicide rates. Those are going to start coming up because now that we've been doing this for more than a month, we're going to start seeing those numbers start coming up. So we got to protect against that too. Most importantly, devastating the economy. All of us primary care practices are suffering from not seeing as many patients because people don't want to come in, and trying to come up with ideas on how to keep people safe. But the bottom line is we have to open up again. It's the policies that we need to do to open up again that'll be key to keep people from getting more sick or having no hospital bed That'll really raise the death rate. So by showing it by county, number one, you're seeing maybe where you want to live in the future with any future pandemics. You're seeing that being spread out has value. You're seeing that cities are vulnerable to not only pandemics but violent crime and social distress. You're seeing people going out to the governor's office with guns on, saying we demand that the state be open, and it was perfectly safe. It's a demonstration. They weren't ever going to use the guns, but the state troopers were all there surrounding the governor's office.
Come on, bring a mask. Don't bring a gun.
It's a show of, I understand it. It's a show of freedom, and they were never going to use it. They were going to just show how judicious and safe you can be. But it does feel terroristic to some people. To me, I feel safe when I know a person has gotten their concealed carry permit and they say that they're going to follow the law to a T. And if they have their gun with them, they're going to protect me. So I'm of different opinion.
Leave it at home, okay?
But it's a show of freedom. This is like you said. This isn't the other countries. For instance, Sweden. They very much trust their government. So when the government says, "Yeah, we'll let you guys decide on your own, but we encourage you to social distance," 50% of the transportation sector is still not being used. The people are doing social distancing on their own because they trust the government. So you don't have to put a measure like we do here in the United States saying we have to be there for a month and almost put in some law enforcement. And that's the other thing I'm thinking about. When this all happens, say, we had that one person who walked through a Walmart saying he had coronavirus and was licking things and stuff. He made a YouTube video and then he got arrested. This was on the western part of North Carolina. How are we going to police that? Because, some people are going to say, I don't care if I got coronavirus. I'm going to infect as many people as I can because immunity is good. Well, do we get law enforcement involved with that? Do we put them in jail? What are going to be the social policies regarding people who want to disobey or people who don't? We're talking about making apps so that people who have coronavirus know who they've been connected with. We're talking about apps saying, okay, I got coronavirus, so now I'm immune. That becomes like that Black Mirror episode about social score, where if you have an app that says, oh, here's my social score, I got coronavirus, I can go wherever I want. Well, that's not egalitarian either in the United States. So there's a lot of social policies you have to come up with before you do a full open, because otherwise you'll have a lot of social disorder.
So the thing that I have is, hopefully we are going to work on the situation where the mortality rate will start declining with coronavirus. Unfortunately, we're still seeing a high mortality rate. I'm sure that there are other diseases that cause just as much. But to me, in law, because I deal my other life, on the other side of the TV show, I deal with domestic violence. I have an invention that I'm launching for domestic violence. And so that has concerned me during this time. And we generally will see a rise in that during times like this. But I think when you deal with law and arresting people, it's what you do with knowledge and the intent.
Correct.
Right.
And that's interesting.
And then the cause, what happened, right? The cause and the effect, right? So what was your knowledge at the time that you did it? I know I have COVID. What was your intent when you walked in there and licked everything? Was it to make everybody sick, or, were you just being a jerk? But that counts. And then how many people did you infect? And then you have to be liable, right? Then they make what your liability is. Are there laws written for this yet? No, but there are similar laws that can make them very, very accountable.
Yep. I'd love to hear about that app, because I was chairman of the board of UCare Incorporated here at Sampson County, which is our domestic violence and sexual assault program. We went from about 2 to 4 people going into the shelter a week. We're up to 36 in a 2-week period.
Yeah, and it's climbing. And there is one thing, when you talk about the safest city in the world, when people call me and say, my daughter is a victim of domestic violence, I tell them immediately, move them to this one particular town, because they took domestic violence into their own hands and they reduced it to 0 fatalities and 0 repeat incidences, 0. And I know that they break every law in the world, but they've reduced one of the most heinous crimes. There's 12 million victims per year, 12 million females. That's females, 24 children, and about 6 to 8 males that are victims a year, and nobody does anything. Mine isn't an app. It is a full-blown patent invention with tracking devices that allows you to key in the data for the protective order. But we know protective orders don't work. They actually inflame, but these will. And what it does is it makes everybody accountable for their movements. So if the victim is lying, we're going to know. But if you remove the device or tamper with it, an alarm is sent, real-time alerts are sent to the police and to the victim, and data is collected for court. If they've breached the order in any way, we can backtrack the tracking, we can show the data, and a real-time report is generated to the police so they can intervene, and so that the victim can seek safety. The victim is notified as well. It all works. We just things happen, and I'm not able to launch at this time, but it is. We want a beta, and we're raising money to beta it. It is a phenomenal tool. We're going to be able to utilize it for at-risk youths. So we're not always putting them in jail or putting them in prison. And also to help prevent reoccurring crimes. That's the key.
Yeah. You already mentioned it. There's more deaths from domestic violence than the flu and coronavirus every year.
Yep.
But how much attention are we putting to it? So for me, having my master's in public health, I think I save more lives doing my domestic violence work than I do with even talking about coronavirus right now.
You do. The only thing you're doing is helping us prevent the spread so that we can get back to our lives. That's all this is about. But and until we get control of it, fear is the biggest problem we have right now. And that's one of the things we wanted to do, is reduce fear with knowledge, give people some ideas and tools to work with, so that we can think about going back to work. Like that woman was real upset about not being able to go back to work. And then I gave her the idea of, well, just write your own policies. Nobody's writing policies right now. Let's start establishing standards. As far as the domestic violence, I would love to work with you. It is an honor. Thank you so much for your work, because people don't understand it is the silent crime. It doesn't get any attention. And just recently, a friend of mine's close friend was just killed. The girl and the father both were killed because he was there trying to protect her. And this has been weighing on my mind because I know this is a problem. So thank you for your work.
Yeah, it's going to be a lot of collateral damage right now coronavirus is going to kill more people with domestic violence, if you ask me, because the collateral damage, when the violence happens, it's not just the person who's surviving the violence that has the damage. It's the people around them, like the gunshot wounds to their co-workers, or the attacks to the boyfriends, or that kind of thing. There's always more collateral damage than the person who's being attacked in the first place.
Right. And people don't understand that about domestic violence. When I built my tool, it wasn't about just protecting the victim themselves. It was about protecting their families too. So the device is worn by the family members. We program in address. I built it almost foolproof. Not everything's 100% foolproof, but I designed it so that we monitor the cars, right? That they can't get, because that is a big attack zone, is a person's car. You can't watch it all the time. It's not on video camera. Then I protect their families' homes. I protect the schools, their workplaces. But what's really cool is you can always map where they both are at all times. If they both go to the same concert, the victim can then choose, I don't want to be in this building. I'm going to leave, right? If we notice a pattern, this is the great thing about AI. If we notice a pattern, then we can say, hey, there's a pattern here. Somebody needs to talk to this person.
Yeah, that's wonderful use of technology. In fact, that'll save more lives for the law enforcement, because you'll know it'll be a preemptive attack on preventing the violence before law enforcement is having to come in when it's at its highest temperature point.
Well, a lot of people don't know this, and I guess I do because of the research I've done over the years, is that it's the most dangerous crime an officer's dispatched for. And by law, they're no longer allowed to be dispatched for domestic violence on their own.
Right.
They're not. And sometimes by accident they are. I have a T-shirt that I wear from one of the officers who was killed by somebody who was known for domestic violence. And I guess when he took the call, he didn't know it, but he was killed. And so, but it's a dangerous crime. I want to get this launched again and get it going. I know it works. We've demoed it and had everything ready to go, but things stop for a reason.
Well, I'll be glad to help you and get the word out.
Thank you. But not just get the word out. Maybe we can work together in raising the money to make it happen.
Sure.
So some of the things we talk about on our show, we have business and startup days. And one of the things I talk about is in raising money, there's a word called mush. You cannot get money for these kind of research, and that's municipality revenue driven, university revenue driven, school revenue driven, and hospital revenue driven. Those things are the hardest things to raise capital for because they expect grants to cover them. But grants are very hard to achieve, even with a tool like this. And you mentioned something, you called it collateral damage. We're just, unfortunately, it's not taken serious because it's just women and children mostly that are being killed. And the only time you hear about the crime is when a celebrity's impacted.
Right. Yep. And that's that, I've already had, I have protective measures in place because I've had multiple men say, "You're stealing my wife from me." And then they accuse me of having an affair because I'm working with the domestic violence shelter, even though I have nothing to do with the situation, but they're coming after me too. And I just understand the threats and I'm not even a close family member. I'm just the guy who was helping out the domestic violence shelter. So I can understand all the other people and how they feel, and I'm even that much further remote from it and still having my life threatened over it.
And you are dead on about that. And so one of the reasons why I incorporated where I incorporated is they're allowing me an extra layer shell so that we don't get attacked, because the offenders always go after everyone that's making them angry. But you say that I was attacked by an offender in the courtroom after the hearing. Mm-hmm. I was with the victim. And she didn't want me there, but I refused to let her go by herself. And when we walked out of the courtroom, he attacked us. And she froze. You know how victims are. They have severe PTSD. And they might, kill for their children, but for whatever reason, that offender just makes them freeze. And I threw a punch at him. I screamed for help. So she tells the story better than I do. I shoved her back into the courtroom and screamed for the bailiff. But I threw a punch at him and he ducked and took off. I don't think he expected that. But like you said, they blame you. Like, you're there to help, and odds are you're there to calm the situation down and maybe make it better, but they blame you, and it's scary.
So just to explain that freezing reflex, that's called the Totzelian reflex. That's like a possum, when it gets attacked, it goes into a dead pose. So the Totzelian reflex is when a person freezes and if they're act dead, then the person might stop and say, "Wait, I'm not going to attack someone who's not attacking me." And it's very common. The reason I know about that is when I learned hypnosis, I have a lot of people who either have a frozen hand or their body freezes, and they go to all these neurologists and they think it's Parkinson's, and Parkinson's never shows up. And what you find out is they've had a trauma in their life where their life was threatened. So their life has been a Totzelian reflex. Anytime there's any stress, I know a lot of patients have had a Totzelian reflex with this coronavirus. They just go to bed and they curl up and they just act dead. So the Totzelian reflex is a survival reflex that a lot of people who've had domestic violence do, and they just freeze, even though the natural response would be the adrenaline would shoot up and they'd punch them just like you did. Well, she had been through it so much that she's at the most base response from the limbic system to act like a possum. So I hypnotize that out of people. I do a lot of PTSD hypnosis, and people who are frozen up. I had one lady she went to a neurologist who suggested me to hypnotize her, and she looked like she was having a seizure all the time. But what it was her Totzelian reflex was so bad, she looked like she was shaking with seizures, but her EEGs never looked abnormal. So after 2 hypnosis sessions, she never had a seizure ever again because it was the Totzelian reflex.
Wow. I think that's awesome, because one of the reasons why so many women die in the domestic violence is because of that. They can't fight back. I don't know what it is. Some of them will try to run. But I think that's the reason why she had been beaten so much over the years, and because she's just bigger than me. Like, she's a gorgeous woman, but she just couldn't fight. But I know several other victims. Again, if somebody's trying to hurt their kids, they'll kill them. But for whatever reasons, when their husbands or their spouse or their significant other goes after them, they just freeze and they get the mess beat out of them. Yeah. And I'm going to send them all to you for hypnotizing, because we're going to do this program, right? So we'll do a system. You get the bracelets on so that we can track, and then we're going to hypnotize you so you don't panic, you react. And I studied Taekwondo. I think that's why I threw a punch before I thought about anything else. My reactive measure was knock this guy off his feet. she couldn't believe it. She goes, "You're going to get yourself killed because he's going to fight back, the next time." But he stays away from me. He absolutely stays away from me. But what are some of the things that we could do to? You said you've got the PPE under control. Do y'all have your PPE equipment now, or?
We were lucky to get a delivery this past week from. We're part of a accountable care organization, Allidaid, and they had arranged for us to get a lot of masks, but the masks for the patients, not for us. So we still have a shortage of N95 masks. We were lucky that one of the up-and-coming Medicaid companies that's trying to get into the managed care space, Centene, sent us a bunch of masks because I'm on their board. So they said, okay, let's see what we can do for our people. So we got a few from them, 35, but every bit helps. But we still haven't had a good amount of N95s come to us.
I've got some. I got a backlog order. I'm not a backlog order. They over delivered in one of the facilities.
Well, we'll be talking.
So we'll talk after this because they're looking for they got to make a little bit of money because they paid for them, but they overloaded. They got bought too many. So
Sounds good to me.
Dr. Arthur, I believe that we need N95 masks for every single day. Do you think we can carry the N95 mask for a week or maybe a month?
You have to because of the shortage. So we're using the protocols on disinfecting the masks. I put mine in the sunlight. I just put it on my dashboard and let the sun burn it up.
Oh, that's smart.
You could use peroxide.
That's what I do.
Yeah,
it's better to get it on the sun basically.
What we don't know, but I don't think I've been looking, but I haven't seen a study on how the fibers degrade each time you do a disinfection and if the virus can get through. So once I see a study like that, then we'll know more. We just know that when people do the disinfection studies, there's no virus on it the next day. So it's clean from the virus, but how much is it protecting you from the virus? I haven't seen a study about that yet. So, but you do what you do. This is better than nothing, and it's better than running out.
Yeah, it's safer. It's safer than no mask at all. And so many people are making their own homemade mask. And I've been looking at some. They got some that are filled with some kind of carbon filter, and But it'd be nice to get some that just pop off and you throw in the wash machine once a week, or you put in your your dishwashing. Wherever you wash your dishes and sanitize them.
So I just got a brand new mask cover. There's a fashion house in Raleigh called Gray Chenier that just opened. And unfortunately, coronavirus hit when they were about to open their line. So they sent me their haute couture leather mask cover so I could be in style.
I love it. That is so.
So you can still be fashionable and take care of coronavirus. So that was really cool.
Do you just wear it, or do you have to put another one under it?
Oh, you have to wear an N95 under it.
Okay.
For me, at least, with the work that I do, of course. But I'm using that when I'm out in the community.
There you go. I just hope that they're putting another one under it, not just wearing the fancy part. But
right. No, I'm putting my N95 under it. And amazingly, I thought the leather would keep me from breathing, but actually I could breathe pretty good through it.
That's nice to know. That's really nice to know. I'm looking at alternatives. I still like Darth Vader's mask, because it covers my hair, it kind of clips on, and, I'm good. I just need to be able to breathe. But I think Darth Vader was on it because he's also got that laser. And I was wondering, why does he have that laser saber? Now I know. So now we got the breathing mask that's really containable, and the lasers to kill the germs that are out there, right? Because we know that the lasers kill the germs, so they say. Is that true?
No, that's for social distancing. The laser.
Who's going to stay near? Yeah, who's going to stay near me with a saber, right?
And it's also for when social unrest occurs because people have been locked up too much.
See, that's what I'm afraid of. I'm not the virus is almost contained. I'm afraid of the crazy people when they get out.
But Dr. Arthur, I think that people they should do the haircut, and they should, I think, clean their beard as well during COVID. Because
I had a beard before all this, but I needed my mask to fit to be able to filter, so gone. It was a nice fashion statement when it I cut my hair a lot shorter because I knew I wasn't going to get a haircut for a month and a half. So,
and
this is the same haircut.
It's very stylish. I kind of like the new haircut he's got. I noticed it the day he showed. I'm like, wow, did you go to a salon? It looks great. He's like, no, I did it myself. But no, these are just things I guess we have to think about. That's what I keep telling people. You know, it's one thing you go out with all of this on, but when I get home, I'm going to have to shower or do something with my hair because it's going to get in my hair. It's going to get on my outer clothes. I can throw in the laundry room and sanitize them because I have a sanitizer in there. But all of these other parts of I guess we're just going to have to shower when we get home.
Mm-hmm. Yep.
Because your hair, I mean, that scares me too, because I got a lot of it. It keeps growing. I can't get it cut right now. So
I think the best COVID preventive look is what Willy's having without hairs. You are good to go, basically.
bald is bad. He's bringing out the bald. Bald is bad. That's right.
I'm going to get my Willy haircut tomorrow.
There you go. It's easy from what I hear. But yeah, we're going to make bald is bad look because
Dr. Arthur, we have Dr. David joining us from
David.
Hollywood. Good evening. How are you?
I'm good, thanks.
How are things in your research world? Share a little bit with us.
Well, my research world is I've got a camera on my face, but what you can't see is my articles about quercetin. So there's a whole nutritional world out there that I'm just starting to get into. It's not my real research world. I'm waiting for my research world to be resurrected after 16 years in limbo.
So what are some of the things that you're learning about with what we're dealing with right now? You had some interesting things, you know, you've shared some success stories of the asthma treatments working well with COVID patients. Are there some other findings that you're finding out?
Well, it seemed, I mean, the problem here in Miami is that we don't have testing. And I'm not sure what it's like in Raleigh, but so I mean, there's some people with classic symptoms. I just came across one this morning, and she actually got tested yesterday, but it'll be next week sometime before we ever hear about it. Meanwhile, you have to treat her for something, and so I'm using quercetin for her because of this asthma patient that I'm waiting on his antibodies to send off his case report. But until I got the asthma patient, I was treating everybody with prednisone as if they were asthma patients. And that didn't really work with the asthma guy. I mean, he did horribly on even high-dose prednisone. He's still suffering from the acne from 120 a day of prednisone. But it didn't do anything for his for the burning in his chest and chest pain and shortness of breath. And whereas quercetin, a couple doses made it go away. So I now think, since quercetin is so harmless, and people have been excited about quercetin for ages because it's a great antioxidant and looks like it should be very helpful. It's just been very hard to show that it's useful for anything. Now it looks like there are all these quercetin researchers who, if I just email them, maybe they'll start banging their drums for quercetin in the setting of COVID-19. It's clear that you can't get anywhere without a team of like-minded fanatics. And so they're the vaccine fanatics, and they seem to control everything we hear. There were the quarantine sequestration fanatics who've been running the show up to now. But I don't honestly know, even if quercetin works, which I'm convinced it works, I'm taking it myself. I don't know how to get word out, honestly. And even though it seems to me like everybody needs to take something like it if the states are reopening.
What is your thoughts on that, Dr. Art? How does one get the word out if they've got success of certain data? Because you mentioned something too about data just not being presented well.
Oh, well, first of all, the terrible thing about our current medical research system is it's money-based, and you're not going to get any research out there unless there's a product behind it or there's a surgery behind it. So there's a huge bias right now in the way research is presented. So exactly. Follow, as one of my instructors in finance taught me, follow George Washington. Well, that's Benjamin. If you follow George Washington, then that's how you get the research put out there. But, for instance, how much have you heard about what I've talked about hypnosis? Very little, but hypnosis has been out there for a long time. So yes, I agree with you that needs to be published. It needs to be put out there. The first thing is case reports, as you're putting out. And then once the case reports get a lead, then you get a randomized study, or you put some people on it, some people not. And hopefully the medical community looks at it. But the problem is the medical community mainly looks at what's in the journal because it's been put up there by a drug company. But this is the type of stuff where it'll get out there, because when people see, oh, there's good information on the show, that doctor gives good information, then it'll take a spread. Because I was talking about it the last time. The Mediterranean diet is what I recommend all my patients when they're healthy. Oh, yeah. Aside from, the weight loss diets and the portion control diets, Mediterranean and the capers and the things that contain the substances you're talking about are excellent antioxidants, and life expectancy is longer if you eat a Mediterranean diet, which is high in capers. So I fully agree that the evidence is already out there. You just have to prove it, but you're not going to get it through the usual biased, commercialized system of medical information right now.
Well, it's like you don't see them pushing out commercials to eat more oranges, but they'll push out eat more Pringles, right? Or just goofy commercials of drink more Coke, which Coke to me just I enjoy a good Coke whenever I can, but it can become very addictive. But it just turns you into one big blob.
What makes me sick is in the journals right now, I see more articles on the financial impact of coronavirus on medical systems and all. And I still haven't seen many articles on the care of a coronavirus patient after the hospital.
I haven't either. I haven't heard about it. I have not heard one report from any recovered patients.
And that's what I need to know right now.
So what exactly, are they signing a waiver when they get treated with COVID that they don't talk to the press and they don't talk to anybody? Are they signing?
Not that I know of.
Because the only thing we heard was, there's one or two people who were like, oh, thanks to Donald Trump, I'm taking this hydroxychloroquine and I'm cured. That was the only two patients I heard.
Yep. I've not heard one. Well, that's the thing. Those studies are out there and they're showing good promise, and they're showing, it's still, they're not up to par as far as a randomized, double-blind, placebo-controlled study. But the ethical issue is, do you do randomization and control studies and not give the medication to someone when there's a lot of evidence there that the case studies are showing that it works? Right. So we're in a catch-22 there, because we're in a crisis. People are dying, but do you really put people in a control group where they don't get the medication and let them die?
And also, where you talk about hypnotizing people, a lot of doctors are unfortunate up in New York area, and the patients are dying at a massive amount, a rate that to the point that some of the doctors are unable and incapable of dealing with it. And one committed suicide, an EMT committed suicide because it was, I guess, more than what they could handle. Maybe they had other problems, but is there something that we can do, maybe even in a meditation state, to help maybe hypnotize ourselves to not be so overwhelmed with this?
Just any meditation, even just 1 minute a day is all it takes. Breathing 4 breaths in a row. I think Dr. Wheel in Arizona taught the 4-7-8 breathing technique. That's what I use. I'll do it for 4 rounds and my shoulders will drop instantly. But I'm lucky because I've hypnotized myself to be able to get an instant relaxation from that. But here's the problem. A lot of, we are taught in medicine to suck it up, just be tough. You're going to deal with this. You just have to suck it up. And that's not good right now. You can't just suck it up. You hold all of that in, and then you go home and maybe perform some emotional abuse on your family members. You can't do that. So 1 minute of deep breathing will clear your brain from all the chatter of, oh my goodness, my coronavirus, my life, my finances. You have to learn to quiet your brain. And the problem is a lot of people in medicine don't have the muscle memory for that. So meditation and relaxation is a muscle memory system. It's just like a sport. If you're good at a sport, the first time you swung a golf club or a baseball bat, the ball went all over the place. It didn't go straight or point at right field when you're Babe Ruth and the ball goes right to right field and you hit a home run. It takes practice and muscle memory. meditation is the same. The first time you meditate, your body's going to be tight and your brain's going to be chattering the whole time. After a month of practicing just for 1 minute or 60 seconds, your brain is quiet and your shoulders drop. But you have to learn the muscle memory for that 1 minute before you can go to 2 minutes or 3 minutes. We're not asking people to be Buddhist monks and shave their head like Willie and whip themselves and do it for 7 days straight. You can't, they practice that for years. Americans, the American version of meditation I teach is sit down and shut up for a minute, because that's what Americans respond to. Punk rock version of meditation. Sit down and shut up and just be quiet. And
a rap song.
Exactly. It's a little bit like heavy fisted, but when you do it for a month, all of a sudden your chatter stops for a whole minute. And then we can get to 2 minutes, then 3 minutes, then 5 minutes. Then all of a sudden you can do it for an hour. And then I don't know if you saw the movie that just came out that has all this controversy. It's called Close Encounters of the Fifth Kind. And it's a meditation video on how you can contact UFOs to show up in your backyard when you meditate.
I'm in. No drugs involved. That's good. Because you can adjust your mental state of mind. And, you know, it's funny you say that, because when I first started my prayer sessions, when I first did the lockdown, because I started before the U.S. did, I decided to do prayer every day. And it was hard to shut my brain out, right? My brain was going everywhere where it should. And I would kept going, stop that. Stop, pray. You know, I had to keep telling myself to pray. Mm-hmm. It's funny how you say, because your shoulders do kind of like you get this, I could do a 30-minute now without my brain going everywhere all the time. It was hard. I will tell you what, hard to do. But I don't bring my phone in there. Everything's gone. Everything's out, right? Just anything that could, because I am interrupted driven. Most of the world is, right? You probably are, but I am interrupted driven. And it is easy to, if I'm in work, to interrupt me and say, okay, I'll just switch over and do this. And so to pray and meditate is very, very hard. I got to make sure there's no interruptions.
That one devastating piece of news we heard was the ER physician in New York at one of the busiest hospitals for coronavirus committed suicide. And you're hearing all the reports. There was nothing in her life that would have led anyone to believe she was depressed, because she kept with it. She was doing the job, but she committed suicide. So this was anticipated before all this happened. Like you saw the app programs like Headspace, and I forget the other one. They instantly said, if you're in healthcare, we're giving you the paid for app for free. And I took advantage of that. And I do Headspace every day because I need that ding reminder to say, hey, it's time to meditate for your 1 minute. Because like you said, we're interruption driven. So interrupt me to meditate too. So the app interrupts me and I interrupt myself. Oh, wait, hold on, 1 minute, done. And then I'm back to work. So if you don't get that practice now, your brain's going to fill up with all this chatter of, oh, I lost another patient. And what you're starting to see now is nurses and doctors are starting to get compassion fatigue, where they've had so many bad situations that they start hardening up, and they're starting to feel like Nurse Ratched in One Flew Over the Cuckoo's Nest, where, you know, she's dealt with so many psychiatric patients in her life. She just doesn't treat them with any compassion at all. She's just military. And we don't need that right now in the healthcare field. And so you got to keep your own compassion for yourself first, so you can have empathy for others. So meditation is the way you get that.
And her father had talked to the press a little bit. He just said that it was overexhausting. It wasn't that it was underappreciated, because it seemed like the whole world seemed to say thank you to the doctors, but she was just overexhausted. Mm-hmm. And she also had been tested positive with COVID.
And that's the other thing people are asking. Was it the coronavirus that affected her brain, with all the things we now know it does to the brain, inflammation, mini strokes, those things that we're starting to see? People are starting to ask, does coronavirus cause depression? So that's one thing to start looking at.
Well, I think a lack of sleep, you know, having dealt with depression myself over the years because of the chronic disease I have, I have a tendency of falling into that depression realm occasionally. I know what it is now. I can detect it. Does it mean I stop? Sometimes no, but I do get better control over it than what I did many years ago. But it's lack of sleep. I find if I not sleep like you stay in bed sleep, I'm talking about real rest, where your body totally closed off and you rested. And my doctors helped me pinpoint that too. They said, Kim, it's when you, and I go, well, I slept 8 hours. And they go, no, you didn't. you weren't sleeping 8 hours. You thought you were sleeping 8 hours. And when they showed me the difference, it was huge. I could overcome it. And I believe in the hypnotist theory. I believe in meditating because I went to a pain psychiatrist who helped teach me these things to overcome the pain if I can't get the medication. Not really overcome the pain, but just overcome that overwhelming thought. So
one of the things that I found most effective, because of our interruption culture and the jobs that we've chosen, I started doing flotation tank therapy in Wilmington. They have a True Rest float spot, and I think one opened up in Charlotte and one was going to open up in Raleigh. But the whole coronavirus thing, you can't use a publicly used flotation tank right now but the magnesium sulfate does kill it because that's how you float. There's tons and tons of Epsom salt. But I would do 30-minute sessions once a week, and I would wear my Fitbit, and my sleep cycles improved tremendously. Like,
so
just my overall rest improved.
Because I do water therapy. What are you doing in the flotation tank?
Well, it's a complete sensory deprivation. So you can't hear anything except your heartbeat and breathing. You're floating in a tank where the temperature is the exact same temperature as your skin. So you feel like you're literally floating. And, there's no lights. So when you open your eyes, it's just as dark as when you close your eyes. And when all those senses are removed, all you have is your brain talking to you. So when your brain's talking to you, it starts, because all your other senses are empty, your brain starts stopping the chatter, and all you do is just have an empty brain. So it's a very intense way of getting yourself to a meditative state. So people who have a hard time meditating, I tell them try the flotation tank. All of a sudden, their brain, they can meditate a lot faster than if I have them do the 1 month at once a day, 1 minute situation. So
part of my therapy, I do a lot of water walking and therapy, but one of my therapies was very similar to what you're talking about, except it wasn't dark. But they would lay me to where my body could float. There was little float things put to where my body would just float in the water, and they would calmly move me. I would close my eyes and they would move my body in a certain format. It was to help my muscles stretch a certain way as well without any restriction. But it was so relaxing and calming. When I got out of there, I was mentally changed, not just physically.
Yeah, I mean, this is all anecdotal, but there are studies about it. But I feel so much mentally sharper for weeks after one session.
Yes, Ankit?
Dr. Arthur, I mean, can someone meditate while sleeping? Is it possible to meditate while sleeping, maybe with a conscious mind or an unconscious mind? What do you have to say about that?
It's funny. I always go when I meditate. Like last night, I did a meditation session, and I woke up after it, but I knew I was meditating. So I was in that lucid dreaming state where I was aware of everything I was doing, but I was asleep because my body felt rested. But I knew I was meditating because I came out of it when I was ready. So yes, my answer is yes, that they're very similar states, but they're not the same, because when you're meditating, you're actually not sleeping, because you're actually revving up the brain. To keep the brain quiet takes a lot of brain energy, and it's actually a revving up of the brain, a more higher level of consciousness rather than a lower level of awareness. So you actually ramp up your brain and the activity in the theta stages when you're meditating. So I think they can intermesh and intermeld, but you can do both at the same time. Correct?
Yeah, I've done it before. It was with a doctor's help, I was able to do something similar.
I think Dr. David needs to leave. Dr. David, are you there?
Leaving?
Yep.
Oh,
I'll see you all another time.
all right. Take care.
All right. Bye-bye. Nice to meet you, Dr. Apolinario.
Take care. You too.
Bye.
And keep doing what you're doing, and get that research out there.
Yeah, that. Let's share the research with me. Maybe I can share it.
Okay, I'll send you the case.
Let's see what we can do about connecting data.
Well, you see how quickly things go viral on YouTube, so use the social channels.
Yeah, but you know what? The viral stuff is usually the really stupid stuff.
Yeah, that's why you want smart doctors like him to be viral too.
Right. Well, we're going to work on that. What we'd like to do is just get some really good video statements of what your research is. And that would be more individual video time. So, but absolutely.
And my 18-year-old asthmatic, he would be happy to go on TV.
That's what we need too, or some testimonies, right? We don't have any testimonies of recovered patients. This is what we've been talking about, right?
Yeah, that's just irresponsible news reporting. They should be. You'll see a story here and there. This is what it feels like. But why don't you talk about what it feels like to be great afterward and to feel like you're immune to it and how you're giving away plasma now and all that stuff? Those are really the stories we should have.
They won't come on TV. No, you don't understand. I've reached out. I've read a lot of posts of people who were surviving it, and they would tell their story every day. I breathed in, felt like breathing glass. I ran a fever for 2 days. So you read their bio of what happened, but they will not come on TV. Not one. Not one.
Why not?
I don't know. And I have tried. I mean, we've read the letter from Paulina, which is probably my favorite letter of the experience, and I would love to get Paulina on, but nobody will come on TV.
In fact, people who are in Spain, Italy, China, and a couple of more European countries, they don't want to talk about Corona.
And
I think I can find you somebody. Remind me, and I'll get you somebody.
Well, it would be great, even if they came on with you just to talk about
Sure.
the experience, and you too, David. Bring get a guest to come on that somebody who's recovered, just to talk about the experience, because honestly, none of the news media covers any of that. All we see is Trump's face.
You never see a live interview. That is crazy. That
the
really
other
is crazy.
thing is 3 million patients
It's all scripted,
and no
basically.
treatment. Yes, I mean, I find that amazing. And remdesivir, the evidence is very underwhelming. I mean, there's these two curves, the placebo curve and the remdesivir curve, and they go up in parallel. I mean,
right. But you're hearing that the most in the media right now, which is also,
I want to hear.
Just doesn't make any sense.
That's what I keep saying. I don't want to hear the little touting that happened. I want to hear about what the doctors did with you, what your conversations were, what motivated you mentally, because I think mentally is a huge part of surviving any disease. They proved that in the Ebola outbreak back in 2014 in Nigeria. The reason why they were able to have so many survivors that they never had before was the mental state of mind. They truly believed it was the mental state of mind. And I think that that's something we need to gear up for. We talk about the immunity, mental state of mind, good rest. These are things that we need to focus on. But testimony, when you start hearing testimony, your fear kind of depletes a little bit.
Right.
So
we should also go on COVID biographies, patients who are coming out of COVID and they are doing good. That those kind of books or maybe documentaries would be very. I think it would be good for the public who are out and fearing of the COVID. So that would be very inspiring. I mean, but that should be come through a doctor.
Yeah, and I think so. And I think too, some other things that we're going to be looking forward is, some of the reentry policies, but also equipment that people can get at home to test with, right? Like test yourself for fever, test yourself like the oxygen meter. Like my boss, Nick, he goes out. What does he do? He buys an oxygen meter because he keeps hearing, oxygen depletion, and he doesn't want to turn blue. So he listened to us when you were on the other day. He goes. So he went and ordered an oxygen meter for his finger.
Yeah, and it's pretty cheap, so why not? And it's good to have in your household, especially if you have an asthmatic.
Right.
Yeah.
And
or
he's
emphysema
asthmatic.
patient.
So he's like, I'm getting one of those. And I'm like, I am too. Oh my gosh. So no, but these are good things to talk about. Like, what kind of tools can we do at home to test ourselves? Hearing the testimonies will help give people a little bit of leg up. What's up, Bankit?
And so doctors, I mean, we have two doctors on our panel right now. So I would just, for our viewers, I would like to understand how important is calibration when we are using these kind of mobile devices as compared to the regular devices we have. Checking the oxygen meter, checking the BPs and checking other stuff. Because I think mobile devices have a different, numbers in comparison to the real. Yes, Dr. David. I think he's talking.
He left. Okay. So what do you
Dr.
do about the calibrations? Because that's very important.
Oh, very important. But what would be amazing is if somebody invented a cell phone that would also test you for oxygen levels, and it just had it all incorporated there. Temperature, oxygen levels. Yeah.
It exists. It's the app is there where you can interface there's sensors. We were developing them actually with my invention with SAS.
Mm-hmm.
So they wanted to be able to take the meter reader and have the oxygen meter and heart and interface it to an app that goes on the phone. So that has or is being developed.
Yep.
It's not.
And that would be so important to incorporate with telehealth. That way we have the vital signs over a week in our doctor's office with the patient not coming in. So, the big idea is to incorporate, because the world has changed. We're already looking at construction issues with our office. What do we need? What door is going to be where the sick people enter? What door is going to be where the well people enter? We used to have one door because we base it on finances. We want all the people to come in and give us their information on insurance in one door. Well, now that we have this pandemic, we have to reshift and say, okay, this is the sick entry, this is the well entry. We're starting to look at all those construction costs and all that. So it's a different world, and anything that helps. Checking yourself at home temperature wise, checking the oxygen levels like we talked about, just an overall, if you don't feel well, have a good relationship, have a primary care doctor in the first place. A lot of people still don't even have a doctor yet, and they're relying on, rapid treatment centers where they see somebody different every time, sometimes even somebody on TV, where it's important to have a relationship. Because if I know how you cook your food and what kind of activities you do, and if you work at the Smithfield pork plant, I know what questions I should be asking. I know what to check on you. I know what medicines to avoid, better than if you're just walking in and I've never seen you before.
That's a good point.
Yeah, and so once again, we talked about primary prevention last time. That's a big one. You got to have a relationship with some kind of primary provider. That's somebody you can bounce things off of. Like, one of the great things I have going on now is with the telehealth is, before, I was so busy, I couldn't just pick up the phone and answer their questions. Well, because things have spread out a little bit, the interruption lifestyle, people are coming into me saying, hey, I've got this, this, and this. What should I do? Okay, stay home and let's get you a coronavirus test, but stay home so we don't spread it. And you're quarantined until we get the results, and do this, do this, do this. Go outside, enjoy your time, meditate. So I'm getting to do those little fireside chats with these people in a way that I couldn't do before, which is more important than that 15-minute office visit. So the way things are changing, I'm loving it, because this is what I became a primary care doctor for in the first place.
I was sharing with the team, one of my favorite doctors that I love for many, many years. He was my doctor from 1986 until 2011 or 10. But anyway, and he retired. We said we would retire together, but he beat me to it. But he would do my physical, right? But then he reserved time and we would have tea. And it was all about, at that moment, 30 minutes of how's your life. But he would share his life with me. But he did this with every patient. Because he said it was very important to understand your home life, what you were doing, how you personally felt in here, not just the physical, not just the test results that the blood and the pap smears and stuff like that, but it was just the overall. And I felt better with him. I felt better. So,
and that's good. What you're seeing with me is that's why it's both an art and a science. You have to be good at the science. You have to be good at data, but you also have to be artistic in the way you handle people. And I became a much better doctor when I became a hypnotist, because then I understand the subconscious motivations of things, that you can't just tell somebody eat more vegetables, because when you tell them to eat more vegetables, when they're already binge eating, more vegetables still equals 3,000 calories a day. So then you have to sit down and tell them, oh, well, an elephant is a vegetarian. So it doesn't matter if you're eating vegetarian, if you're going to eat like an elephant, you have to eat the proper amounts. So you get to learn the artistic side of getting people motivated, motivational interviewing, what really drives them. So I always find out, you always ask, well, what are you coming into my office for? Oh, to get my blood pressure taken care of. No, what are you really coming into my office for? Oh, well, my blood pressure is high and you need to adjust my medicines. But why do you need me to adjust your medicines? Because if I don't, I'll die. Well, why don't you want to die? I've got grandkids. Okay, so every day you come in here, when I ask you, why are you coming into my office? It's because I want to be there for my grandkids, not blood pressure or this or that. That's the motivational interview. So when I say you need to quit smoking, doc, it's too hard. I thought you liked your grandkids. Oh, yeah. And then boom, you link the cigarette smoking to they won't see their grandkids, or I put a mental picture in their brains. Imagine yourself continuing to smoke 10 years from now, and you've had your stroke and your grandkids are wiping your butt because nobody else will do it.
Right,
no. And I say, okay, imagine yourself 10 or 20 years from now where you quit smoking and you're watching your grandkids at the Olympics getting their gold medals. Okay, I like that better. I said, well, do you see why you need to quit smoking? So every time they pick up the cigarette, they have a mental picture of their grandkids wiping their dirty butt. That's an easy way to quit
And
smoking.
that is so true, folks. Let me tell you. I mean, you know what? It may sound rude, but it is the honest to goodness truth. When people are dying of that disease, that's what you end up having to do. When you become the caregiver at home and hospice comes in, it's not the nurse taking care of them, it's you. And I didn't mind it. Trust me, I would do it 100 times over because my mother, she actually didn't do anything to cause her cancer that I'm aware of. She never smoked, never drank. Her biggest weakness was dark chocolate. So, but she died a horrible, painful death of cancer, and that's what I had to do. You're absolutely right. I love that visual. Heck yeah. That's what you have on the advertisement of cigarettes.
Your grandkids wiping your butt. Yeah. See, that should be the Surgeon General's warning. It should be, if you keep smoking, you see yourself having your grandkids do your toileting for you in the future.
And, you know, as much information as we have out there, people still smoke. And that's one of the reasons why I like CVS pharmacy. Is they took the first biggest stand because, you know, pharmacies is where you could buy a lot of cigarettes a long time ago. And they refused. They finally made a policy that they were no more selling cigarettes at their stores anymore. And they said, we know we're going to get a lot of people hating us and dropping business with us. But in reality, their business picked up in the pharmacy part. You know, they reduced their costs. They made more deals with insurance companies, I guess, but they stopped doing it. They still sell beer and wine and drugs, but they don't sell cigarettes. And I was like, I commended them. So that's why I shopped there.
That's putting your money where your mouth is. But that's the other thing. You know, people are starting to get antsy about getting out and all that, but you got to go back to the real reason we did this. We don't want to see our grandparents dying prematurely from a terrible death by themselves. That's why we all stayed home. And people need to remember that, because we don't want to just suddenly go out there and open things up without good measures, teaching the businesses how to do it, having the social distance. Now that we're used to it a little bit, people are like, okay, let's social distance. Okay, let's keep wearing our masks because we don't want to cough and become a super spreader. So I encourage still wearing the masks, because the masks are preventing super spreading. So we need to do that probably for a year, maybe longer. Once the 60% immunity kicks in, then great. Let's take off the mask and let's let whoever get it. But the real reason we did all this was because we love our families, we love our neighbors, and we do not want to get up to 11% death rate, which is what the estimate would be if we didn't go social distancing. So it's working. So let's be smart about opening things up. Yes, we need to open. We need to prevent the domestic violence. We need to open soon, but we need to open smart, and we need to keep caring about our neighbors, keep caring about our grandparents, keep caring about our most vulnerable people. Because when you go back to it, when you ask, why did we do this in the first place? It's because we care about each other, and let's keep caring about each other. And let's not be selfish, and let's not try to open the state up too fast. But yes, I care about my friends who are losing their businesses and all that. We still need to take care of them too. So let's do it where you prove to us that you can open safely and keep people socially distanced. Let's let you go back to business.
And, you know, so many other countries were able to, achieve this, like Hong Kong. And everyone says, oh, well, Hong Kong, they'll shoot you if you disobey. And I'm like, well, we should shoot you if you disobey here too. But, you know, I'm for that. But I like your thing of super spreader. Okay. I like the super spreader word. I like your message to the world of, you know, what do you want? Do you want to kill your grandparents and that they die alone? Because quite honestly, that's how they're dying. And I think that's what was hurting the nurses and doctors is it wasn't just watching all of these people die. Several of the nurses and doctors who shared their stories a little bit were in tears because people were dying alone.
So I've got one hard story, because the nursing homes here have had lockdown, and I had one patient. They were lucky enough to be in the same room because they both had an illness and they were in the same room of a nursing home. And unfortunately, the husband died during coronavirus. So she was not allowed to go to the funeral. Family members are not allowed to come in and visit because of preventing spread. So she couldn't get a hug from even her family members. And the look on her face I think it's devastated me in medicine more than anything else. Even though I've been through a lot of things in domestic violence, I've cleaned up murder scenes and blood from walls from a murder scene after domestic violence. But the look on her face of not being able to see her husband one last time was.
I'm sorry. That's what's hard. I'm sorry.
It's the most devastating thing to experience as a physician.
I'm so sorry.
Because I came into this job to hug those patients and I couldn't even do that.
We shouldn't be put in that position. I'm so sorry.
So we can't open too early. We just can't.
And I want to share with the world that this is the pain and anguish that the doctors are suffering every day. And if you don't stay home, you might put someone at risk that doesn't get to say goodbye to someone. And that's the painful part. You know, I've held a lot of hands of my family members who have died, and just being there, knowing that they had somebody to hold their hand was the big difference. And you're right. I'm so sorry that you've had to even see someone's face like that.
It's haunting. You just don't want to ever see it in your life. It really is haunting.
And like you said, there's some more devastating things that you think in the world, but it's the heart that is very hard to take. And maybe we've found a little bit of an answer of how we can help the doctors out there overcome this pain. And
and I'm lucky because I got the meditation. I've been through tough things, but you're still human.
I'm feeling for you, but I'm also feeling for her, because when you told me about it, I could visualize, because when you love someone very much for that long and you're in the rest home together, that's got to be devastating. And so we shouldn't have to be going through this. And thank you for sharing that, because people don't know. They're so immune to the sympathy of all of this because they don't hear it or see it. And it's painful. I mean, I kept hearing this, that people don't get to say goodbye. And that's why the nurses were having a hard time, is you're not used to that. You're used to, as a doctor, even when you're having to care for someone dying, that they get to say goodbye. You're used to that. You're not used to the distancing, to the and that's got to be hard. I just can't imagine.
Yeah, technology is great and everything, but FaceTime does not replace a hug.
No, it doesn't.
Neither does an emoji on Facebook.
Neither does this. We use this as our hug, but it doesn't replace it. So, but the the meaning is there. But we can't FaceTime in the ICU room while somebody's dying. We can't do that.
Yeah.
Yep.
So, Dr. Arthur, I mean, that's why, I mean, a lot of our old, citizens or people who are living in their 80s and 90s, they said that whenever we visit a doctor at their era, at their time before, maybe 80s, 70s, 60s, doctor used to check the nerves, and they used to touch and they used to feel what's happening in the body. But nowadays, it's more about the reports and the lab reports and things like that. Occasionally, they just check the heartbeats and all. So why there's a change? Because they said that those doctors doesn't need those kind of reports. Now we are based on reports, and maybe in future I don't know what's happening with the practice. But do you think that the test matters a lot more than the report?
It's the melding of the two worlds. You have to be artistic. You have to be human. You have to listen to your patients and their lives. You can't take care of a patient if you don't know how they cook. You can't take care of a patient if you don't know who their pets are. You can't take care of, I mean, the pets can spread disease too, not the coronavirus, but, other diseases. But, you see that I'm one of those doctors that's trying to meld the two worlds with both the hypnotherapy and with the domestic violence things and all that. We need leaders and people who just understand both worlds well in order to take care of the world the right way.
No, I think you're
absolutely.
You are doing a very good job, and we are proud of you.
And we're going to work together on the domestic violence stuff. I had no idea you were connected in that world.
I think we just figured out a pretty strong partnership right there. So we'll get it working.
And I'll see about getting you the N95s that you need. Any other PPE equipment, Um, there's all kinds of people that call me all the time now. And all I try to do is just connect the dots at this point, because there's just not enough time in the world to do anything else. But absolutely. But it's like you said, that we got to get back to a different mental state of mind if we're going to survive just being at home. We heard David K. Johnson talk about his daughter being in a little apartment in New York. And immediately he was like, no, she can't stay in that little bitty place by herself. So they figured out a way to go pick her up and bring her to where he's at, so that there's more space for her, because people are locked in they don't think about getting out very often. When you start getting depressed, you don't go out that door very often. And when people don't get out and get the movement in their everyday lifestyles, more depression sets in. And of course, financially, everybody's freaked out. And one of the things that we're doing on our TV show, and I'm thankful that David K. Johnson has agreed to join us, and we're going to get David M. Walker and a couple of other financial experts. But on Mondays, we have Economic Mondays. And that's the conversation we're having, is how not just the economic country needs to come back, or the world, but also how each of us individually can start looking at different solutions and ideas. Because this is what I told him the other day. The depression isn't because the whole world has economically failed. It's each individual person doesn't know how to get back up again. And that's what we have to focus on, is the individualness, not the world. We keep talking about the world, but that doesn't fix me. I can't feed my kids, right? And that's what we got to talk about. And like you said, how can we get into these homes and hug these people? Can we go in with PPE equipment? Can I volunteer to go in and hug?
Depends on the social policy of the county, unfortunately.
Because now my heart is breaking, because elderly people are very, every people's dear to me, but so many elderly people are lonely anyway. But right now I'm just like, how can I somehow or another go hug these people, or how can we get them to know that we care? Because they gave us their lives for 70, 80 years. They shouldn't be in this boat.
It's not for them to go out that way. So
no, it's not. No, it's not.
Yep. But I was dressed in full PPE during the situation, and I just the risk was it was too early in the whole coronavirus thing. And it's tough, because that's, one reason people ask me, why did you, it was between neurosurgery or being a family physician. That was my decision, because I really love neurosurgery. I was able to do a full surgery when I was a medical student at one point.
Wow.
I loved it so much and was good at it. But people ask, why did you become a family doctor instead of a neurosurgeon? And I said, because I want to eat pie with my patients, because I want more spiritual payback rather than financial, because, primary care makes way less than a neurosurgeon. And I also wanted to get my life going. I didn't want to do 12 years of residency over 3. But the bottom line was, the main decision for me to go into primary care and to become a family doctor was because I wanted those moments with my patients, which are so few and far between if you become a neurosurgeon. Yes, you save people's lives, you drain blood out of their brain, but after they left the hospital, I never saw them again.
Yeah.
But the family doctors kept seeing people over and over. So that's why not only did I become a family doctor, I went all the way as far as I could and became a rural family doctor where people really needed me. So, that's, you can't make your decisions in a bubble. You can't just say, let's go ahead and open everything up. You can't say, let's keep everyone locked down. It's right there in the middle, squishing the grape. It's right there in the middle. So us scientists, social people, which are family doctors, we're always right down the middle the whole time. We're always like, do you really want to do that cancer treatment when you've lived a good life and that cancer treatment will cause more pain? Or, you have a long life ahead of you. Why are you not doing the cancer treatment? Why are you not quitting smoking? So we're always in that middle squish the whole time. And right now we're at that squish point. We've done the social distancing. We've gotten the curve down. Now it's time to open up, but let's keep in the squish zone where we're not causing more harm than good. So the one thing about all these policymakers and people making decisions, us healthcare workers, we've all taken that oath to do no harm, not do some harm, do as little harm as possible. We took an oath to do zero harm. So all my thoughts, all my decisions, why I become so much more of a social doctor as well as a rational database. You can see I'm doing the data down to the T when I talk to you guys. But that's what makes me better in my social discussions, because I say, well, your percentage of getting coronavirus in Sampson County and dying from it is 0% right now. but that may change. It might be like Italy, where it was 8.8%, where every person who got it, 8.8 died. So, or 8.8 of the population. I can't remember which that was, death rate or case rate or what. But the bottom line is I have better information. I can tell a patient, okay, if you don't quit smoking, your chances of your child wiping your butt in the end is 20%. And I can give them a firm statistic, which then I can go, okay, so let's talk about hypnosis for your quitting smoking. So you got to go between both worlds the entire time to be the best you can. And it's the same with this whole coronavirus situation. We got to be between the worlds of economics, the worlds of finance, the worlds of social, the worlds of mental health. We got to put them all together and do the least harm as possible. My goal is no harm.
And you make a good point there, talking about that towns might be safer, and this has kind of spawned something in my brain that, okay, so we want to slowly engage and get back into the workplace, but it could all of a sudden just catch fire somewhere like a wildfire and spread real fast in certain areas, and that's what I call centralization of containment, right? So I think our policymakers need to start thinking about what, like we have EMTs to go out and help people get to the hospital. But if there is a area that just flares up, we have a pandemic team that just moves in real quick, right? Mm-hmm. And that team just immediately puts that fire out as fast as they can, as eloquently and quality of life as possible. Even if it means that you quickly pop up a center that's where only the disease people go, right? Mm-hmm. That way you pull it away from the hospital zones, and you pull it away from the medical centers that still need to treat their other patients. I don't know why we didn't do this to begin with, where we didn't have places that were established where it was just COVID zone only, or flu-like symptoms, and then that's all that goes there. And like you were doing, you sit out there and test people in their car, and if somebody's mm-hmm. sick, you throw them in for treatment, right? And
if I remember, I got a lecture. I was in a medicine leadership training, and one of the lecturers was from SAS. And the instruction, he showed us a program that could find through artificial intelligence flu outbreaks before they came out through Twitter. It would garner up Twitter posts, find the people that were putting symptoms up, and it could find the hotbeds of flu outbreaks before they even happened just by reading Twitter. And I know SAS has that technology already.
Wow, that's amazing. That is amazing.
So we just have to put that to use.
Yeah. AI will change the world, and so as the healthcare industry. And I think the future of AI is much more better, but we need to understand the artificial intelligence through roots, basically, then only we can implement it. And as Dr. Arthur said, that it's very easy to track through AI what are the symptoms and who are doing all those things. And then we can plan through locations accordingly. And Dr. Arthur, I will take you 4 years back. And you know how the Trump planned the campaign before the elections. So they searched on social media, and they were planting those speeches what people would like to listen.
Yep.
And that happened through AI only.
The same type of research works.
Yeah. And then whenever he goes out to any state, he knows that what he wants to say. And he was saying, and then the dots got connected, and people were like, wow, so we want to hear that, and he's saying the same thing. So let's vote for Trump. And that's what happened. And that's the next phase. I mean, all elections, everything is going digital. So we have to be smartly tracking those digital counterpoints and then plan our AI technology accordingly. And I think doctor should introduce AI in their course as well. I'm not sure whether they're doing it or not, but AI should be a part of our life now, because post 5G, everything is connected, and it's difficult for anyone else to go outside that 5G life cycle. And that's what AI comes in.
Yeah, it's just like a rock band. Anytime a rock band goes into town, Australia is the greatest place in the world, or Raleigh's the greatest place. You use the same technology, but if they mess up and say Dallas is the greatest place in the world and they're in Philadelphia, then you failed. So you want to make sure that you have those fail-proof systems as well.
Yeah, but we need a good monitoring system as well before planning anything, because AI can be done, but if we are not monitoring our data right, because everyone is collecting data. But if you're not analyzing the data and implementing the ways how we can use the data for a brighter future, that is what I want to see the research and things going on. Because all the companies in the world, they're collecting data. But I don't know how they are using and implementing the data. That is, we need to start working on. We know about COVID before the COVID came. We know that these many people will be dying and all those things. We have some numbers in mind, but still nothing happened.
Right.
Yeah, because all of that data is segregated. It's not from a central database. If it's from a central database, then that'll be a different story. But IBM's got their own data. Somebody else has got their own data. I mean, that's the thing that's happening with the world nowadays. Everybody's doing their own small gig. There's no centralized point, and that's why we have this problem.
Well, once they get all the data, and that's the thing, everybody has to put their price tag on it. And you can't put a price tag on it if everybody works together and makes one centralized database.
Yep. Hey, while you were talking earlier about the float tanks, I came across a pair of glasses that had lights in it.
Mm-hmm.
And I use that. So the name of my media company is 4 Plus Minus Media.
Mm-hmm.
So 4 Plus Minus is from the wave cycles, where deep sleep occurs and creativity begins.
Look at them using symbolized language. Very nice.
Machine language. Technology can scare. I've been in technology since I graduated in 1984, and telecom and datacom, and I've watched it grow tremendously. But something that we just never invested enough in, we tried, was medical. Right. And again, we never invest enough money in medical anyway. But talking with India today, I was very encouraged to hear that they've shifted huge amounts of money to invest in medical research now. That will they have decided to have established a new footprint that will continue. Like, it just won't be just for this. Because so also often, just like with domestic violence, right? Oh, it just happened. It's real big, and they go and try to get things going about it, and then it fades away. And the same thing with medical research. You fix the problem, and they don't want to continue the research. It goes away. So,
and the problem is we have very short attention spans, because just like the Spanish flu, they put all these things into place, and then they forgot about it, and then more outbreaks would happen. So, it's short memory span in healthcare.
Not just in healthcare, though. It's in law enforcement too. All too often, we'll hear about a death and go, "How heinous was that?" And we're going to change the laws, and you get that traction going, and then people fade away. It's like 2 months later, everybody forgets that person died a heinous death, and nobody's interested in it because it takes a lot of work to get a law in place and things like that. Joe Biden was probably the only one who really push the efforts and the laws for victims of domestic violence or victims of violence in general. He wrote the law, he pushed it, and he's had it implemented almost every year, and every new president, he makes them sign it.
Yep.
I think she's having a tough time managing the connection today.
Well, talking about short attention spans, I was, just to prove short attention spans, I went up to a bunch of friends. I said, "What do you think about those Australian fires?" "Oh, yeah, I remember those." They totally forgot that they even happened.
They were just a couple of weeks ago, right?
Mm-hmm.
No, you're right, though. Attention spans is a big part of the reason why we don't get anything done. My whole thing is about proactive, not reactive. But we are a country based on reactive solutions, not proactive. And another thing I've discovered is nobody has any interest in it, being a part of it, unless it impacted them. That's just it. No, there are very few people who will get involved with a cause and they'll go, "Oh yeah, that's a great cause," but then all of a sudden the door's beating you down. "Hey, I need your help. I need your help." And so it's very, very hard to get the interest.
And I think the world is also in a different situation, because medical industry is kind of stuck in that insurance web. They are not able to come out from that insurance web because people are, paying that insurance and then trying to wait that whenever they get sick, they get a good treatment, and that didn't happen because of the insurance policies that this will not cover, and then it goes like this, and then you won't be able to see a good doctor. What do you have to say about that?
Totally agree with you.
the insurance is a mess in this country. So
yeah, and that's one of the policy things we need to look at. What are we get? So many people lost their jobs now because our economy is based on a lot of employee-produced health insurance. Now that so many people have lost their jobs, if they get coronavirus, they don't have health insurance to cover them. So what's the social policy for these people? Are we going to just let them, hang out and get a $400,000 hospital bill? Or right now they're saying it's $40,000 you get if you put coronavirus on a hospital diagnosis. But we're in an impossible situation that we got to look more, I hate to say it, but because it's the United States, but we got to look more socialistic at how we're going to take care of
I've been pushing the socialistic insurance for quite some time for several reasons. One, it's kind of been there's not enough money in our Medicare or Medicaid program, and we pay into it, right? But we also buy insurance. We pay into Medicare, which is used for people who need it, or when I get retired. But then I have to buy insurance over here. Why not just pay a little bit more or a lot more into Medicare? It feeds it and takes care of me all at the same time. I never understood that. So I'm paying for something I'm not going to get.
You're in the United States and people want choice, because some people want the Ferrari version of health insurance that covers everything, and some people want to have a deductible. And so there's all those choice things and all, and it would be great to have that. But I'm one of those great people, squish it in the middle. Because that always comes up with the best ideas. And, where you have that tension, then you come up with really good ideas in the middle.
Pay one time, why pay into so then you have 3 or 4 versions of Medicare, and I pay $500 into Medicare and I get this version. Or I pay, but right now I'm paying $2,000 a month for this insurance plan that doesn't give me anything anyway because I'm on Cobra. And which, by the way, my insurance went from $200 a month to $2,000 a month.
Yeah.
Okay. They call it Cobra. Cobra's supposed to sustain you while you're unemployed, right?
But just like any Cobra, it bites you.
You can't afford it. I mean, $2,000 a month. My house bill isn't that much. So I like the socialized thought of insurance. I don't think it's going to reduce our health care. I think it's going to increase our health care. I think it's going to improve it. I just think in the United States, it's impossible to go 100% socialized because of people wanting Cadillac versions or Ferrari versions of health insurance. But at the same time, we're starting to see how this is getting strained in a pandemic. Like I always said, managed care, you can manage everything until a pandemic hits, and here we are. So I've had my doctors say before insurance became what it is, they used to be able to afford treating the patients without insurance, right? It was $40 for a visit or $25. Back when I was younger, it was $15 a visit, and the doctor was making a lot of money, like the doctors. Mm-hmm. And I can remember when I was 18 years old, paying my own doctor visits. It was like $18, $20 a visit. To me, it seemed like a fortune, but I was getting good medical care. And I didn't have to pay for insurance. And if I had to go to the hospital for something, it didn't cost me $10,000, $20,000 for the visit. It was somewhat, I would have to work hard, but I could pay it off just like I did my education. I paid my own education as I went through school. So I think you're right, though. I think we need to reform the healthcare plan that we have.
Now, I trained in a very interesting system in Louisiana. They have the charity hospital system. And so it was socialized. People didn't want to call it socialism because of the bad, connotations to the word. But it really was socialized because anybody could walk through the door and the state would pay for their care, just because of how devastated, how wide the economy was between rich and poor. But the charity system took care of the poorest people who couldn't pay, and it took care of them. Like people would come out of state, get hurt during Mardi Gras, and they would get a hospital bill, and if they couldn't pay it, it just disappeared a lot of times. I don't know if it's like that now, but the charity system had always been there, and it was a socialized system that Louisiana did a really good job for. But the politics being as they are, taxes look really high because they had to pay all those expenses and all. So, it works if you have a population that's willing to be egalitarian like that. And that's where you hope that a situation like this helps people open their eyes and say, we're not just going to let healthier coronavirus patients just die and not get a breathing machine and throw them out of the ER just because they don't have insurance, which, you hear people getting really aghast at that. How dare they throw them out when they don't have insurance? But that's happened all along until now. But the other thing is, what are you going to do about the people who don't have insurance now, that have lost their jobs, the economy's torn up, and they need medical care? Well, we have to do something for them too. And, North Carolina has been a state that hasn't expanded Medicaid yet. And we were actually working on a plan to do that until this all hit. And it got delayed a little bit. And, there are managed care companies that are working towards making more open and available Medicaid system. But unfortunately, this has shot the budgets of the state completely. So we'll see what happens.
Yeah, and I would like to talk to you too, because I know you sit on the board of what we're making the decisions of what we're going to be doing here in North Carolina. So I would love to have more talks on that as well.
Yeah, I'm lucky because I'm with the board of the North Carolina Medical Society. I'm on the board of Centene, one of those Medicaid. So just full disclosure, I'm on the board of one of those Medicaid managed care insurance companies. I'm on the board of the medical decision making for that as well. So they have a primary care physician making the decisions, not an accountant who says, okay, these numbers make sense. So that we've always needed physician leadership at the front lines. So Carolina Complete Health, which is the insurance company made by Centene, has doctors in the front lines of the decision making, not businessmen, not
it's not like Blue Cross where somebody's making a decision on whether I get a treatment or not as an accountant.
Well, it'll be like that too. There's going to be insurance numbers as well because you got to stay solvent. But Blue Cross Blue Shield has actually done a good job. They actually chose, physicians as their CEOs. They were the first group to respond to doctors here. In fact, they were the first ones to say, telehealth, we're going to pay the same as everybody else, as every other visit. And they said, we got to take care of the doctors. We don't want you guys to fold. They were the first insurance company that told us.
I'm glad to hear that.
So they actually understand what's important. I was, you're quite surprised when you're butting heads with insurance companies all the time. And then you really feel that they understand when they do that and you didn't even ask for it. So that was pretty amazing on their part.
No, I'm sure that there's a lot of the good stories we don't hear about the insurance company. So I'm glad you shared that because, you hear all the bad. You don't ever hear the good. And I'm glad to hear that they actually put physicians. So Dr. Tula is with us from India. Have you met Dr. Tula yet, Dr. Art?
No, not yet. How are you?
So Dr. Tula is with us.
Doing well.
Good to see you. Good to see you.
Dr. Tula, how is it going?
Kim and Willie, my dear friend, and Kim, they're doing great. I mean,
Good.
Willie is always smiling because he's sitting in Australia, the socialist setup of healthcare, all needs taken care of.
Yeah,
so no problems at all.
Taking off. He's one of few who have a startup that's actually taking off. Yay! Success stories on IBM TV. This is what I tell people. We're about the positive influence and making things right. Finding the solutions. We're not, we can talk about the problems, but we're not here to just complain about them. We're here to find the solutions. And Dr. Tula, you've had quite an interesting journey since you've been with us. When I first met you. So how are things going?
So, I mean,